Today we want to talk a little bit about the placement of the 12-lead ECG. An ECG, or electrocardiogram, is a graphical representation of the electrical activity of the heart, and an ECG is usually indicated, ordered, necessary for things such as chest pain, dyspnea, syncope, acute coronary syndrome, pulmonary embolism, and possibly myocardial infarction, or what is commonly known as a heart attack. You need to get that graphical picture of the electrical activity of the heart, and so it's very important that you place the leads in the appropriate places. You begin then, in order to get the proper picture, by placing 4 of the leads on the appendages, or the limbs, the arms and the legs. This is normally done distally at the wrists and ankles, however it can be done proximally if necessary. So you begin with the 4 limbs, arms and legs, and then we've got these letters here, V1 through V6, to let us know which lead goes where. And beginning at V1 then, we'll begin at the right side of the sternum at the 4th intercostal space. You place 1 there. V2 is then left of the sternum at the 4th intercostal space. So these would be on either sides of the sternum, but horizontal to each other. At V3 you go halfway between V2 and V4. So let's find out where V4 goes so that we'll know where V3 in that midway point between the two goes. V4 is left of the midclavicular line at the 5th intercostal space. So if you get that correct, the midclavicular line at the 4th intercostal space, then V3 will go midway between V2 and V4. V5 and V6 are both placed horizontally to V4, and they go out to the anterior axillary and mid-axillary line as you work your way out. Sometimes it's necessary to mirror this setup on the right-hand side to get a more complete picture of what you're trying to determine the electrical activity of the heart region for these various reasons already mentioned.